Yep, hold on. I said how long? Go in there and sit down. Go in there and sit down.
prefixes express measurement. They can indicate quantities such as much, many, excessive. So poly, that can mean much or many. Okay. So much, many, or excessive. So in the term polyuria, so what do you guys think this means? Urea, so urine. Okay. Now, do y'all know what my suffix is in this term, polyuria?
U.
So this is my suffix, the IA. Okay. So that is pertaining to, or a condition pertaining to, so suffix first, I have a prefix, excessive, or much, or many, urine, or urination, polyuria. Okay. Common one, you guys have heard, so people say, you're so hyper, I'm so hyper, or whatever. Okay. So hyper means excessive or above. Okay. So you have excessive energy. Okay. The term hypertension, sure everybody's probably heard that term. Do y'all know what that means? Yeah, so this is high blood pressure. It's excessive or above the normal conditions. Okay. The opposite would be hypo. HYPO. Hypotension is going to be low blood pressure. All right, letter C, prefixes express positions, direction. They can be used to describe a location. So hypo, this was used to describe like an amount or a number. Okay, but then there's another term, sub, that's describing a location. Okay, so if I have low blood pressure, it would be hypotension. It wouldn't be subtension. Okay, sub is a prefix that's describing a location, that's under. So where's a submarine found? Underwater. Okay. So another one we just mentioned, what does around mean? Or what's the, yeah, prefix?
Peri.
So around means, or peri means around. An important one that everybody needs to know is going to be ante and post. So you'll see it in the term anterior, posterior. Do you guys know what that means? Anterior and posterior?
Back and front.
Yeah, so post is back or behind. Ante is in front of or before. When you're describing the patient, so the way that you guys see these diagrams, whenever you look images of the human body, you always see this diagram of that figure that stands like this. Okay? The way that it's outlined, or this position, that is called the anatomical position. Okay, so you're always going to describe the site anatomically correct to the patient. Okay, so if let's say you did a venipuncture right here, so where would that be? So be more specific. Some arms.
Anterior of the left arm.
Interior on the left arm.
Okay, so it's the patient's left.
The
Okay, so
patient.
the way you're looking at it, it would be your right.
You're right.
Okay, so again, always anatomically correct to the patient. So that's going to be the patient's the left anterior arm.
Left anterior arm.
Anterior and the front side, because it's not the post,
Right.
it's not the back side. Does that make sense? Okay. Your urethro, So the term erythrocyte, the term cyte means cell. So what's erythrocyte? Close. What's erythro mean? And what's cyte mean? And so what is that cell?
Red blood cell.
Red cell.
Oh.
There's no blood in it. Do y'all know what the medical term for blood is? Hemo. Okay. So though I know what you're saying, okay, that's common knowledge in the medical field. Okay, we know that it's a red blood cell, but this specifically says red cell. So how would you add that term hemo to it? Or what would it be? What would it say? Instead of erythrocyte, what would it say? The other way.
Erythrohemocyte.
Erythrohemocyte. Okay. But now you do have the term blood cell in there, blood in there. Okay.
Okay.
All right. The term white, that's leuco. So what's the term for a white cell? Leukocyte. It doesn't say white blood cell, right? But again, common knowledge in the medical field, we know that that's what we're referring to. Okay. So for example, so what term comes to mind? You guys see this? What comes to mind? What kind of condition?
Cancer, chemo. I don't know.
What specifically? What term? Okay, so leukemia.
Oh.
What is leukemia? So what does that mean? So start with your suffix first. So emia is your suffix, or mia. Okay. So that's a condition. A condition of what? So what does leuko mean? So all this is a condition of white. That's all that says. Leukemia. Okay. Again, in the medical field, common knowledge, we know that that's referring to what you guys probably think of like the cancer patients, okay, oncology patients. Okay. Now, it's not telling me if it's a low blood cell count or a high white blood cell count. Okay. So the common or the medical term could be leukohemocytemia, a condition of the white blood cell. Again, common knowledge, we're not going to write all this stuff out. We just know leukemia. I don't know that the condition is they have a low white blood cell count or a high white blood cell. It's just a condition of the white blood cells. Okay. And then blue, so you're read through cyano. So if, let's say, the patient, if their lips are cyanotic, their lips are blue. A condition of blue. So why would the lips be cyanotic?
They can breathe.
So not necessarily, but yeah, that could be a reason. Okay, so the biggest thing, the main thing that's happening is they're not perfusing adequately. The blood flow is not going to that site because the blood vessels are constricted. So an example of that is if you walk outside and it's freezing, your body's going to start to constrict, so there's going to be less blood flow to that site. So your lips can turn cyanotic. Okay? Yeah, an entire person could be cyanotic. So you might have a newborn, okay, they come out, they're cyanotic, they're blue because they're not perfusing, they're not breathing adequately. Okay? Once they take that fresh breath of air, all of a sudden they've got oxygen in their bloodstream and they turn back to that normal color again. Okay? All right, so do you guys have questions on medical terminology? So again, the main purpose here is for you guys to understand how to break down the term. If you see something you don't understand, start with the suffix first. That goes at the end. Okay, look up if you don't know it. What does TIC mean? And then what is my next thing to look at? If I have a prefix, what is my prefix? And then the last part is going to be your word root. This is cyano is your prefix. So we'll do like 10 minutes, guys, and then we'll get going on the next topic.
Can I ask you a question? When you say the root word is last.
Suffix is last.
Oh, okay. So the suffix is. I thought the suffix was first.
No.
The prefix was first.
No. So that's the first.
Like he's here.
Yeah.
So we'll clean the site, and then you can basically.
Oh, that's fine.
Safety out of the way. You can take the cap off.
I'm gonna go a little more so I don't.
Right here, a little bit more. Yeah, just like that. Alright. You ready? 1, 2, 3. Good. I'm going back there, but that's good and slow. You good? When you're done?
Yes, right here.
Okay.
And then we're gonna go to the little park. 1, 2, 3. Oh, sorry.
No, it's okay.
Stop. You good?
Okay.
Thought you
I know.
patient hold pressure.
Hold on.
Have her hold. The cotton ball.
I need to practice on that. How to whip it. Okay. That's true. I'm sorry. I feel like that one was a little bit more shaky because. Good job. Okay. I'm not gonna throw this in.
So just take your trash, put it in here, and then as phlebotomist, you'll be going in from room to room to room, or you'll have patients coming in, and so now everybody's coming to you, introducing everything. So after every single patient, you want to make sure that you wipe down your area, wipe down the table before a new patient comes in. And I always wear gloves. People will always ask me like, well, why do you always have your gloves on? You're just doing vitals. If I'm just doing vitals and that patient throws up, I don't want to have to stop with my gloves on. Okay. Again, it's not just that they're sick, but also if a patient is not sick and I go and touch that patient, I could have just caused that healthcare associated infection. Okay. If you've ever been in a hospital, maybe you went to visit somebody and even the nurses, or they ask you to put your gown on, okay, there's a reason for all of that. Okay. Sometimes you have to explain or educate the family members and let them know, hey, the patient is sick, their immune system is low, so we don't need anything coming in from the outside and being introduced to the patient, so put your gown on. When they leave, same thing, the patient is sick. We don't need you hugging, loving the patient, and then you leave, and then you introduce it to somebody else. Okay.
That makes sense.
All right, so do you guys have questions on germs, bacteria, nosocomial infections, anything like that? So I'm going to start with module 2, and I may not finish it. I got the important points, a lot of the important information across. So again, I highly recommend that you guys, read through the information or just hit play. It has the audio for it. Just listen to it. Okay. You guys should have already done the practice test 1. If you haven't, then please try to get that done as soon as you can. Because I want you guys to see where you're at. Okay. Again, you're going to get a low score. I don't expect you guys to get 100 on the first one.
I'm
But
getting low score.
you want to see where you're at so that you can show progress from there.
It's bad. I'm so embarrassed.
Well, a lot of this stuff is going to be new to you guys. So again, I don't expect you. Again, you want to do it so you see where you're at, and then on the next one, it might still be about the same thing. But on the following one, hopefully you start to see progress from there. Okay. But if you wait till like week 5 and then you start to knock them all out, you're not going to learn anything. Okay. All right, workplace safety. OSHA has established regulations and guidelines to direct phlebotomists to work at the highest level of safety possible. So this is kind of what we've been going over. You have bloodborne pathogen standards. These protects phlebotomists and other healthcare professionals from exposure to bodily fluids. So that can be blood, urine, saliva, whatever. The standards address use of PPE, which is your personal protective equipment. In case of an exposure, you guys should know what to do. Every organization should have an exposure control plan. So if you guys have a job, if you guys are employed, ask, hey, do we have an exposure control plan? So that's not just for like a hospital setting in case you get stuck. That's any organization. So if you slip and fall, what do we do? Whatever the case might be. So again, if you guys are currently employed, I would ask, hey, do we have an exposure control plan? What will we do in case of an incident? So if, let's say you slip and fall and you don't document it, well, if it's not documented, what does that mean?
That it didn't happen.
That it didn't happen. So when you come back a week from now and you're like, hey, I need to get medical treatment for this issue that happened or that I've got going on, well, where's the documentation? Okay. So even if let's say your supervisor, somebody's not around, but you know where all the forms are located, you can help assist that person fill out the information. So I mean, generally you probably go to like HR or something, but you guys should be familiar with your exposure control plan. And that includes, in case of a fire, what do we do? Just different plans that that organization will have in place. All right, all employees in the healthcare facilities must use standard precautions. So this is just standard across the board. So everybody's going to wash their hands, make sure that you have what you need. When a patient is in isolation, use additional safety measures. So isolation precautions are going to be different. So let's say your patient is in isolation, you have to go and draw blood. You want to make sure that you put on all of the required PPE. So you have to have on your gown, your mask, your gloves, your goggles, put everything on before you touch the patient. Once you're done, you'll take everything off before you walk out of the patient's room. You guys want to know what HIPAA is or what that stands for? Common mistake people make is, well, when you're writing out HIPAA, they'll write out HIPPA. So if you know what it stands for, you shouldn't make that mistake. It is the utmost importance to understand and acknowledge every patient's right to protection of personal information. Patient's protected health information, so that's PHI. You'll probably want to know what that PHI means. Again, protected health information. Then another term that you might see is PII. Do you guys know? Anybody know what PII is? So that's going to be personal identifiable information. So health information is different than identifiable information. So PII is going to be like your name, the social security number, medical record number, things that can identify the person.
But what did you just say? It was patient health information?
So PHI is protected health information.
Oh, protected health information.
So interacting with patients, so know what your scope of practice is. So your scope of practice is basically what you're trained to do or certified to do. So on this chain here, interacting with patients, you have, you want to confirm the identity. So you introduce yourself, verify the patient, obtain consent. So you're explaining the procedure, and you're going to obtain consent for the patient, explain the procedure, perform the collection, monitor the patient response, and provide post-procedure care. So know that as you guys are doing this, we want to obtain consent. So if the patient extends their arm,
Implied
and
consent?
yeah, so that's going to be implied. They're implying consent. They say, yeah, you can go ahead. Obviously, they're telling you. Understand the patients have the right to refuse any procedure, even right before it begins or after they have given consent. So at any time, they can refuse. If a patient conveys mixed message, such as extending an arm but then stating, I do not want you to take my blood, ask the patient whether to continue with the procedure prior to taking any additional steps. Proceed only if the patient again gives consent and is willing to have the venipuncture. Threatening to move forward with the procedure without consent can be considered assault.
Now, I did learn, like, as I've been doing the test and studying, I did learn, like, if they unconscious, then just go ahead and imply consent, because obviously, right, they can't agree.
Right. And I mean, normally you're going to have a doctor, a nurse, somebody else around, but yeah, you're not. If there's a medical necessity to do it, then
Okay.
yeah, we kind of have to do what we have to do.
Okay.
When palpating the vein, do not slap the patient's hand or antecubital area. This activity, once a routine phlebotomy action, could constitute as battery. After applying the tourniquet and not seeing a good vein, use other techniques for locating the vein. So you can like warm the area. So I mentioned earlier, you can use like a hot pack, put it on the area, on the site. Wiping it with an alcohol wipe, lowering the limb. So you guys already kind of went through those different techniques. Quality control. The terms quality control and quality assurance are not interchangeable. Quality control is a measure of position or of how well an instrument is functioning. Quality assurance involves the ensuring that a test is accurate as possible. Do you guys know what a centrifuge is? Yeah. So this is a centrifuge. You'll put the specimens into that centrifuge. It's gonna spin the specimen, but when it comes to loading the specimens into the centrifuge, you want to make sure that it is balanced. So if you have one specimen in there, you want to put another specimen directly across so that when it spins, that machine doesn't start to wobble.
If you have an unequal amount, do you just wait?
You can take another tube, and so like if I'm doing a urine specimen, so if I've got the centrifuge tube with the urine in it and I only have one tube, I take another one and just fill it up with the same amount of water.
Okay.
So now you have two that can balance it out.
Oh, okay.
Yeah, but what if you have, let's say, like that one in the picture where there was 4, but you actually have 5 that you use? You do the same thing?
Yep, same thing.
Fill what the other one did?
Yeah, so if I have 5, and then I'm gonna fill this last one with like an empty one.
Okay.
Or, yeah. These are the different types of devices that you guys are using. So you've used the syringe. Okay, later on we'll practice with the butterfly and with the vacutainer. And in the event of an exposure, you have the eye wash stations in the lab, and then we want to make sure that everything gets documented as well. Make sure that you document, or you let your supervisor know in case of if there's an accidental needle stick.
For an accidental needle stick, immediately decontaminate the puncture site with an antiseptic, such as iodine or soap and water. Next, notify the immediate supervisor, providing information such as how the exposure occurred, the department or area where it occurred, and which equipment, PPE, and safety measures were used. Document this information in the Sharps injury log and in the facility's incident report form. Have a medical examination as soon as possible from an urgent care, emergency department, or whatever healthcare support is available. The provider will ask which vaccines you have had and will likely test for HIV, hepatitis B, and hepatitis C.
All right, so common tests that if let's say there's a accidental needle stick, so there's a whole process to all of that. Okay, you have to notify your supervisor. It's going to have to be documented. You'll be sent to a site somewhere to get tested. But understand that it is very important that if you ever have an accidental needle stick, that you document it, that you get the treatment that you need. So don't try to hide it because you think you're going to get fired or in trouble or whatever. Okay? You want to make sure that it's documented. You want to make sure that if you're exposed to anything, that you get the treatment that you need for that. Okay. Go over we'll go to 11 minutes. So do you guys know what hepatitis is? So we'll go over. So what's itis? Y'all remember? And then, y'all know what hep is? Yep, so hep or hepato. So that means liver. All right, so let's get it.
this? Was it okay?
No, that was good. That was a good one. Okay.
So when you're feeling, you can imagine strumming a guitar. You know, cross like this. Okay, and then don't even look. So look away, and this is where you can feel it.
You did though.
Last time?
Yes.
No, I.
Yes, you did.
Mr. Mendoza.
It went in.
It went in.
It went in like this part.
Did I did I get good?
The first time, you talking about last week?
Yeah.
Oh no, you didn't get me.
That's what I'm
I
saying.
thought you talking about
You already cleaned it?
Oh
Okay.
no, I
Grab
didn't
your
get
syringe.
I didn't get none.
So move that
My first one.
plastic piece out of the way. Now take the cap off. Yeah, just double up. Good. Wait.
1, 2, 3.
That's good. Pop the tourniquet. Keep it on the needle. There you go. Until it came up.
Yeah.
Okay, lock this.
How about this?
Get a band-aid while she holds pressure there.
So I didn't get nothing.
No,
You got it.
I got it.
I did?
Yeah. I think I saw that.
Are you serious? I didn't see it. Okay. Could you please remove that?
Yeah. This for the other hand.
Now that is what I gotta get technique for.
Yes, girl.
So right there, you see?
So this one, oh, I'll let you find it.
No, you
Because there's one, I don't know if you see that one.
Okay.
That one's like super on the surface. So it's like easy. That one.
Clear up.
And then the next one, you can go for that one. Then you come back.
Just one
Did you
time.
feel it?
And now you're just reintroducing all those germs back on.
Oh.
Grab a little alcohol. Just one swab. Set your syringe down over here, but don't stick yet.
Okay.
Raise your quick, quick, quick. That's free. I don't think you got it. Going too slow. Pop the tourniquet. Cotton ball. Patient hold pressure and lock it. All right, go ahead.
One, two, three.
You're good. You're good.
Stop. Pop the tourniquet. Cotton ball.
Yay.
I'll do your fingers. Use the tape choke. Get your band-aid. Do the other arm.
Let me get the band-aid ready first.
Right? That's what I was thinking.
Okay, you can remove that.
There we go.
So you can go ahead and look on that arm,
Okay.
but you're not going to stick yet. So just look for now and then I'll come back.
Yes, sir. Last week I didn't get nothing.
Oh, it's just 1 second. I'm sorry. I'm
So
sorry.
just do one a little low, like right here, so the
Breathing
next
in.
one we can go out of it. Okay, so go ahead and clean her up.
I'm sorry if I'm hurting.
You're good. You're good.
Just one time.
So you can go above it. I don't know if you see that right here.
Mhm.
You can always just go right above it.
Okay. Getting red, I feel
Get
bad.
another
No,
one.
no. I'm generally sensitive, so don't worry about it. It's not that it hurts. It's just my skin gets red just for whatever reason. So you're good. You're good. You're doing good.
You wanna do that?
2 down, 2 up.
So,
I just want to clean her up.
Yeah. But you see that? Even the tourniquet, it's just my skin easily gets red.
and then, so right in here, okay, that's where we're gonna stay. So you got it, 1, 2, 3, quick, go. Good.
Go ahead, put the
Now
tourniquet.
relax this hand.
Let's see so you can.
That's good. Tight hold, grip right here with your fingers. That's good.
Yeah.
So both tails, if you're not sure which one it
And
is.
then when you get out, you get the shorter one. Shorter one gets easier.
Oh. Make sure I fix it.
Yeah.
You're taking too long. Go ahead. Go ahead.
Me?
Yeah.
One,
Move to the right, just to here. Right there.
2, 3.
One a little more. One a little more. Right there. Okay, tell. I don't think you got it.
No, I didn't.
Okay. All right. So, oh, you want to? Wait. You're supposed to pop the tourniquet first. Lock that.
Sorry.
You're good.
Go ahead and get a cotton ball.
Could you hold on?
Yeah. No.
Okay, you can go ahead and remove the cotton ball from me, please. Thank you. Ooh. See?
So with the tourniquet, remember you don't want to keep it on longer than 1 minute.
1 minute. Mhm.
That's why you want to have all of that stuff, everything out here ready to go. And then, so I'm gonna have to come on, that's gonna be your pause.
Yeah.
Stop.
Mr. Mendoza, is this okay that it's like a discoloration right there?
Just look.
Okay.
Okay.
Get her ready, clean
Yeah.
her up, but don't stick yet.
Okay.
Move this one out of the way. There you go.
I'm sorry. Ding, ding,
Stop
ding.
there. That's great. Stop. Pop the tourniquet.
Let me have this ready.
Lock it.
Right now. Nervous because of that little thing. Okay.
Go ahead.
Make sure you're.
Your cleaner?
Yeah.
Okay. And just directly above it.
1, 2. Okay, no. Probably went past it.
So you're directly to the side of it?
Yeah, it hurts.
So go
It's
ahead and
fine.
pop the
I know.
tourniquet. It's your cotton ball.
That hurts. I'm sorry.
Hold pressure. Get your belly.
Hold it pressure.
So do they be using instead of bandaid, cause them bandaids be hurting.
Yeah, they use other stuff.
Okay.
It's like tape or something.
Yeah, but we're not gonna wrap it, take it off, wrap it, take it off, wrap it, take it off. Alright, so now we'll go, that was your second one? So, let's
This
look
was the
at same
third.
arm.
This was the third. So we got one more left.
Take this one off, we'll come back over here.
Thank you.
Okay, so you take that one off, and we'll look at this arm.
Oh wait, let me get that.
We gotta do the turn first. Okay, this is the fourth one?
Yes, sir.
There, go and do your tourniquet.
Oh yeah. Oh,
It's the alcohol.
try to go there. It is. I'll go above you.
Okay, so we're just gonna go directly, so where you went right there. Should go right above. Alright, go ahead and clean her up. Okay, good.
I'm going down. I'm sorry, don't.
Alright, so you know where you're going.
Yeah, I'm going above.
That side's not going anywhere.
Yeah.
So what I want you to do, just count to 3.
1, 2,
Okay.
3.
Now pause. Don't stick.
Okay.
Okay. You're trying to rush through it,
Uh-huh.
and that's why you're shaking. Like
Yeah.
you're anxious.
Yeah.
This is our job, okay?
Mhm.
Once you're there, sometimes you're gonna stick, and you're literally gonna have to just sit there and wait, and just aspirate slowly. So don't try to rush through it. You're
Okay.
good. All right. So now where you're going? Okay. Now I'm not gonna stop you. Okay. So now when you're ready, go.
Oh, dang it. I'm sorry.
Aspirate. Okay. Stop. So bring it out just a little bit. Right there. Stop. Now try again. Okay. Stop. Come up just a hair. Right there. Okay. Stop. All right. So we're not gonna get it. That's fine. So it looks like you're right next to it.
Yeah.
Cotton ball.
She got it.
Yes. Okay, go throw the sharps. Yeah, follow the angle.
So you got
I'm
two.
sorry.
You got two, and then 2 of them was
Well, to the last one, but yeah.
so you was able to draw 2 of them, and then the other 2 didn't.
Yeah.
Only because I feel like you had to go above it.
Yeah, I know.
That's
It's
probably
the
why.
shakiness. Like I got anxious after.
Right, so
So I am back at home from school, or whatever. I just got out of class. Y'all see me though? Like your girl got 2 venipunctures on this side, 2 venipunctures on that side. We did capillary punctures today on our hands. As you guys can see, while we were in lab, y'all, I didn't get to get in depth because my instructor, he is really big on like not recording while we in lab, just kind of focusing. So I didn't get a good angle so y'all could see all that blood coming out. But 2 all them times, 3 times to be exact. We also did the butterfly method on our hands or whatever. We practiced one on a fake arm, a fake hand, and then also performed the butterfly method on each other, right? Y'all, your girl was able to draw blood 3 times today. Whew. Like I was able to get it. Y'all know last week I didn't get nothing and I was kind of bummed out about that, but this is a new week. So yeah, like with that being said, y'all, I was able to learn how to document first of all, document the capillary punctures, And then also we was able to just kind of identify the words in let me just say medications, things like that. We was able to understand, you know, the foundation of the words, you know, breaking it up and learning the prefixes and the suffixes of words. He did tell us about hypertension and hypotension. You know, hyper is high blood pressure, hypo is low blood pressure. He also went over the proper way to just kind of do the butterfly technique. It was kind of different, y'all. Like when I did the butterfly, it was kind of different because, you know, the hand is pretty sensitive, right? And so when I did her butterfly method, I was able to see a vein, but not really so much. So he just kind of like helped me out with it or whatever the case may be. And y'all, when I say I was just glad that I just, you know, got the technique down with the butterfly, because, you know, you deal with butterfly punctures when you have geriatric patients and then, you know, children. But he did also say that if you see like an adult patient, if you see that they have a butterfly puncture, but you notice that their veins are like pretty small like mine's, because he did point that out, then you can go ahead and be like, no, I'm just gonna go ahead and draw your blood, so you can go ahead and get it out the way, do the venipuncture. So that is something that stuck out to me today. And then, you know, also learning different ways of infection control. He also, one thing that I liked about today's class is that he also put like this powder on our hands for us to kind of see for ourselves that, y'all, we hold so much bacteria in our hands. So it's super, super important, because we are dealing with blood, that we don't cross-contaminate, making sure that we are prioritizing ourselves and our patients, you know, keeping each other safe. Always wearing your gloves no matter what when dealing with your patients. You know, we are dealing with blood. I don't want no blood getting on my hands, skin, or anything, and I don't want my patients to feel like, oh my God, like scared, you know what I'm saying? Like if they see any blood, a lot of people don't like seeing that. So he just kind of went over that, and then he got on me a little bit, y'all, because as he was watching me perform the venipuncture, he's like, hold on. It's like you stabbing at her, you know? It's like you're just going straight in. So he did tell me a technique, you know, like count 1, 2, 3, go ahead and poke, but make sure that it's a smooth, you know, it's a smooth puncture. You feel me? Like not just going in like, I felt, because he said, as you can see, she jumped because I started her by the way I kind of just went in on that venipuncture. So I am working on making sure that I'm looking at my past videos. That's another reason why I'm documenting, and also being super, super safe and smooth when doing the venipunctures. So he did say that, and I'm like, okay, you know, I love the fact that he's pointing those things out now. We did go over, you know, the proper way to hold your hands. Like, okay, so with the butterfly method, you kind of tight the skin a little bit, but when I'm doing a venipuncture, you just kind of like tighten it this way. But with the butterfly method, just kind of, you know what I'm saying, like holding it like that. I don't know if y'all can see it, but yeah, that's something that I definitely need to take into consideration, because it helps out a lot when trying to, you know, draw blood. So y'all, today was very informative. We was able to learn a new skill, which is the butterfly method, and then also he did perform you know, on the board, the way to properly document, especially when you're doing the capillary punctures, you know, just basically performed venipuncture or performed capillary puncture on digit 3, 4. The digits are your hands, whatever hands that you poked or whatever. So it's super important that you know the digits when documenting. We always document everything, so that's super important as well. And then also when you're if you just mess up, if you document something and you're messing up, just cross a line through it and put your initials. So that's something that I've learned as well. But y'all, I am loving school. This is week 2. You never want to wait to the last minute to do like the practice quiz and the modules and stuff. So I am on the practice module 3, and I didn't want to do 4 because I felt like I wanted to see where we was at this week. So the rest of this week I am going to go ahead and tackle modules 3, 4, and also, you know, tap into my practice test. I hadn't tapped into the practice test. I just been doing the quizzes. So I am going to go ahead and do my due diligence to make sure that I'm getting this stuff together, y'all.